Welcome to the Mama Civet YouTube channel. In this workout, we're going to be targeting pelvic floor balance. So we're going to be offloading tight portions, overactive portions of the pelvic floor while strengthening the underactive portions so that we can have better balance of the pelvic floor to support a more comfortable pregnancy, support your birth preparation, your pushing preparation, in addition to help support you in the postpartum, because you will still have a pelvic floor even after you give birth. Hey, my name is Gina. I'm a perinatal fitness trainer and birth doula and mom of four. And this is Roxanne, my sister and co-founder, who is a midwife, mom of three, with one more on the way. So we want to walk you through the workout that Roxanne has been doing to help support her pelvic floor during pregnancy, for her birth preparation, her pushing preparation, in addition to supporting her postpartum. And these are exercises that we both have used personally to support our own motherhood journeys and help guide our clients through as well. If you didn't know, your pelvic floor has different quadrants to it, and each of these quadrants is going to be impacted by your different hip positionings, your pelvic positioning, your rib cage positioning. And so we have different types of tension within our pelvic floor. And so in this workout, we're going to be thinking about releasing the tight portions of the pelvic floor, which typically are the right anterior, left posterior, while also strengthening the underactive portions, the left anterior and right posterior. I'm going to walk you through this in more depth as we move through each exercise. So if you're feeling a little confused by the quadrant concept, know that each of these movements, I'm going to thoroughly explain what is happening within your body. All you're going to need for this workout is a yoga block, but you can also use a small stack of books. And so once you grab your yoga block or your stack of books, we'll go ahead and meet you on the floor, and we're going to move through 2 rounds together of this pelvic balance workout. The first move that we're going to do is an all fours hip shift. So you're going to place your left knee onto that yoga block, and then you're going to shift your weight over to that left leg. So like 80 to 90% of your weight is in your left leg. You could lift the right leg off the floor and your body position wouldn't really change too much. So after you've shifted your weight over, we're going to think exhale, pull belly to spine to round in the back, and then inhale to drop your belly down to the floor and look forward. We're going to think exhale, pull belly to spine, round in the back, and then inhale to drop belly to the floor. And we really want to think about keeping weight in that left hip. So as you do the pelvic tilt, if you find yourself kind of shifting back over to the right side, just make sure that we keep that weight shifted over to the left. In this movement, we're targeting the left posterior pelvic floor, which tends to be a little bit tighter for us just based on normal postural tendencies. And so by moving through these pelvic tilts, by really focusing on finding this rounded position, we're going to help to stretch that space between your sacrum and the side of your pelvis. So if you're having any like left SI joint pain, this is going to be super helpful for you. If you're having constipation or tailbone pain, this type of movement can also be really helpful for you. Let's go ahead and take that yoga block out now. We're going to target the right anterior portion, which tends to be overactive. Spread the knees out just a little bit wider than hip distance, and then you're going to shift your weight over to the left again. So this is another left hip shift, but now we have more of that right anterior pelvic floor and right groin and adductor that we're focusing on. So you should feel more of a stretch in your right groin and your right inner thigh. You can also bring the right foot in so that the right foot is more externally rotated. From here, we're going to inhale to look forward to start with an arch in the back, and that may intensify the stretch for you. And then exhale to round in the back, keeping the weight shifted over towards that left. So inhale to drop belly to the floor, and then exhale, pull belly to spine to round. So similarly to that left posterior pelvic floor, the right anterior pelvic floor tends to be overactive for us. And so finding more of these kind of hip shifted with a straighter leg positions is going to help to stretch that groin and adductor to help kind of offload that side of the pelvic floor. If you're finding that you want to just spend time in one position, you can maintain the arch and just hold and breathe here. If you find that pelvic tilts feel better for you, you can continue to move through the pelvic tilts as well. But again, making sure that we're keeping our weight shifted to the left side. Now let's move through our strengthening exercises. So we're going to place that right leg onto that yoga block, And we're gonna start with the right posterior pelvic floor strengthening movement. This portion of the pelvic floor tends to be a little underactive compared to the right anterior portion. So most of the weight is in that right leg. You've shifted your weight over. And what we're gonna do is we're gonna just lift up and down as if you had like a foam roller between your thighs. So exhale, we're gonna lift the left hip up. Hold here for a second, big inhale, and then exhale to hold, and then inhale to drop back down. So we're gonna do one full cycle of breath at the top. So exhale to lift up. We're finding that externally rotated position. Big inhale, exhale, continue to hold, and then inhale to drop back down. And we're gonna continue with that breathing cycle. What's happening here is the right hip is moving into an externally rotated or open hip position. So that right posterior pelvic floor is having to tighten and to contract in order to pull the pelvis into this position. And so that right posterior pelvic floor tends to be a little underactive, a little bit more lengthened. And so we're gonna target that with this right-sided hip lift. So big inhales or exhales to lift. You're gonna hold for a cycle of breath and then drop back down. So now we're gonna come onto our right side to do a left inner thigh strengthening exercise. So we're coming out of tabletop. You're gonna bring the right leg in front of you and the left knee is gonna come behind, and you're gonna place that yoga block underneath the left leg. We're gonna be here for a minute. So we're gonna start with just lifting the hips up, and then we're gonna move through some knee lifts about 30 seconds in. So in this, we're already gonna think pushing weight into that left knee, so you're feeling that left inner thigh activate, and then go ahead and lift the hips up. And now most of the weight is in that left knee, really feeling that left inner thigh firing here. And then we could play around with how much you push the hips forward, if you want the hips back just a tad, but almost think like a slight tuck underneath of that left hip. And then we're just breathing here, using the right leg down on the floor to just give a little bit of support. But if you want it to be more challenging, keep the right foot on the floor and lift the right knee up. And then you can hold here, or you can move through some slow pulses. So you can think exhale to lift the knee up, and then inhale to drop it down, or just hold it. And so that left anterior portion of the pelvic floor tends to be underactive, similar to that right posterior portion. And so these type of exercises help to target that portion of the pelvic floor and the surrounding musculature. So now we're gonna move into round number 2, and we're gonna repeat all of these exercises again. So take that yoga block, place it underneath your left knee. We're gonna find that left-sided hip shift. So we're shifting our weight over to the left side. And now for this one, if you want to practice some like pushing type breathing strategies, we can incorporate that as well, or you can continue with the same breathing like we did from round number 1. So weight is shifted over to the left side. We're gonna think exhale, pull belly to spine to round in the back, and then just hold this position to take a big inhale into the back side. And then with the exhale, we're just gonna release and let go. Big inhale into the back side of the body. And then exhale, just release and let go. Do a few more breaths here, and then we're gonna move into exhaling and feeling a little bit of bearing down. So take a big inhale into your back, and then I want you to think exhale, just push down into the pelvic floor very gently. Big inhale into your back, and then exhale, we're just kind of bearing down a little bit into the pelvic floor. So a little bit of practice pushing. And now if you want to practice this a little bit more deeply, you can do it when you're on the toilet to practice push breathing. But we're thinking big inhale into the back, feel that downward pressure into the perineum, and then exhale, just continue to bear down. Now let's move to that right lateral hip shift. So we're gonna spread the knees out just a little bit wider, shift the weight over to the right, and we're gonna find a little bit of an arch in the back. You can bring that right foot in so that foot is externally rotated in that hip. It's gonna bring you a little bit deeper into that right growing inner thigh. And then really think like right hip you're trying to touch your left knee with. So we wanna have this kind of like twist happening within the pelvis. So we're gonna think big inhale into the back. And then we're gonna think exhale to push down into the pelvic floor. So we're inhaling into the backside to feel increased pressure. And then exhale, we're gonna continue to bear down into the pelvic floor, but really, really gentle. We are not pushing with like max effort. We're not trying to like poop our pants right now. We're just kind of like increasing pressure downward so that we can kind of start to feel it happening. So I would say like a 20% effort. Big inhale into the back. And then exhale, just gently bear down into the pelvic floor just to feel that downward movement with the exhalation. And then explore what type of breathing we need to do. Is it a really gentle exhale to feel that bearing down? Do you need to exhale like you're blowing up a balloon? Like how strong does this breath need to be? And if you don't want to do the bearing down, we're just going to exhale and just release. Now let's go into those strengthening movements. So bring that yoga block underneath the right knee. We're gonna shift the weight over to the right side now. So a little bit of that right hip shift happening here. And then we're gonna move through our knee lifts as well. And so with this, we're just gonna do our exhale and inhales normally, but we still want to really think about that right glute is turning on to really lift us up. So we want to think about, can I bring awareness to the areas that I want to strengthen? So exhale to lift that left knee up, hold at the top, big inhale into the back. Exhale, pull belly to spine, a little bit more rotation, and then inhale to lower down. And so we're just gonna move through that breath cycle. So exhale, really think about that glute is firing to pull your pelvis. Take your big inhale into the back. Exhale, lift a little bit more. And then inhale to drop down. And so this again is strengthening and targeting that right posterior portion of the pelvic floor, which tends to be a little bit underactive. Our muscles only have the ability to pull, not push. And so if we only think about releasing and letting go, which is really important, and we don't think about the strengthening, we're not gonna be able to pull our pelvis into different positions. And our pelvis has to change positions in order to support baby's descent and rotation through. So let's go ahead and find our adductor strengthening exercise. So you're gonna lay down on your right side. Right leg is gonna come in front of you, and then you're gonna place that left knee onto the block. And I want you to think about already pushing into that left knee to help turn on that left inner thigh a little bit more. And you can even start with a slight tuck underneath of the pelvis here. So you can almost think, almost like prepping to go into the movement. So exhale, go ahead and lift the hips. Think slight tuck underneath of the left side. Maybe push forward just a tad. And then we can think exhale, drive that right knee up. And then inhale, slowly release. So exhale, drive up. And then inhale to release. And at about 30 seconds to go, we're gonna do a full breath cycle holding the knee up. So really thinking about pressing into that left knee to feel that left inner thigh turn on. And then we're gonna exhale to lift and hold here. A big inhale into the back. Exhale, lift the knee up just a little bit more. And then inhale to let go. Exhale to lift up. Big inhale into the back and hold. Exhale, lift up just a little more. And then inhale to drop down. Only 10 seconds left. One more cycle. And hold here. And go ahead and release. If you enjoyed this workout, be sure to check out our online prenatal fitness programs. We have our on-demand workouts, which is going to be our video-based workouts like this, where we have prenatal strength workouts, core and pelvic stability workouts, pelvic floor, and birth preparation, all synced to your week of pregnancy. So you can start anytime with one-time payment options, which give you lifetime access, or just grab the months that you need. If you prefer to follow an app and work out at your own pace, we do have our prenatal strength program, which incorporates barbell work in addition to the birth prep, core and pelvic stability, and pelvic floor work as well, but it is in a self-paced format. You can check out all of our options on our website at mamasayfit.com, and we would love to support you in your pregnancy and beyond. And so as a thank you, you can use code YouTube10 to get 10% off any of our online offerings.